I want you to take a few minutes to think of your family, your friends, your coworkers, because injuries happen to people we love and who we would miss if they weren't in our lives. I hear about people like this on the news every single day. People who leave their house, were going about their day, and then have experienced an injury that's life altering or life ending, from a motor vehicle crash to a drowning. Preventable injuries cost the Canadian economy $29.4 billion in a single year. And the story doesn't end there. The human cost that injury brings, pain and suffering, significant changes to health and well-being, it impacts our potential to live long lives to the fullest. The Cost of Injury in Canada report is going to be released on National Injury Prevention Day, which is July 5th, 2021. This report quantifies the cost of injury from a societal perspective, including costs to the healthcare system, to productivity, to the people behind the numbers, the individuals, families, and communities that are impacted by these injuries. Parachute, in collaboration with the BC Injury Research and Prevention Unit, with support from the Public Health Agency, found that in 1 year, 17,475 Canadians died from a preventable injury. 61,400 Canadians suffered disabilities, either temporarily or permanently, impacting their potential for economic independence. 231,530 Canadians were hospitalized. 4.6 million Canadians visited an emergency department. The Canadian healthcare system was charged $20.4 billion in direct costs, and Canadians spent $29.4 billion in total economic costs. That's $80 million per day. And unfortunately, those numbers are not decreasing. Can you guess what the leading cause of injury deaths are? I bet you didn't think of falls. Downstairs, tripping, falling in the bathroom. Falls account for a third of the total economic costs of injury each year. That's $10 billion. Other leading causes include suicide and self-harm, unintentional poisoning, including opioid poisonings, and transport deaths. The story of injury in Canada is a story of potential loss. Unlike chronic diseases, injuries impact the young, resulting in 334,000 years of potential life not lived. These are stolen years of missed celebrations, missed milestones, family memories, and contributions to society. Through work and volunteerism, if you are under the age of 45, you are more likely to die from a preventable injury than any other cause. The human and societal potential loss through injury is immense. Money spent dealing with injuries for hospitals, their staff, and services translates into an average of $56 million per day in the Canadian healthcare system. Those resources, if not needed to treat injuries, could be allocated to other needs in the system. For instance, in the past 15 months, I'm sure more hospitals would have appreciated more beds, and those would have been welcomed by our nurses and doctors. Okay, so I told you earlier that injury is a story of potential loss. But this could be a story of found potential, and we know how to change this story. The fact is, almost all of these injuries and deaths and the resulting costs could have been prevented. We know how to prevent injuries. Wear a life jacket. Design roadways so cyclists, pedestrians, and drivers are safe. Install grab bars in bathrooms. These are not just for seniors. Everyone falls in the bathtub. I'll leave you with 2 questions. How many of your family and friends are you willing to put at risk of dying or being injured? Parachute knows the solutions. We know how to prevent these injuries. Can you help us, help you live a long life to the fullest? Find out more at parachute.ca.